We've seen a growing resurgence of cases in the neighboring country, which is also imposing the great threats to China. And so far, we have sporadic cases reported totaling 100, and also we have seen 2,000 more cases reported in Hainan and the Xinjiang Uyghur Autonomous Region, Guangdong, and other places also right now in the critical period with potential risk of the further spreading. And in Tibet, also have the new cases reported, which will also with a developing situation. In Gansu, Guangxi, Shandong, and we have also seen a cluster of cases right now is slowing down its curve. The working team from the joint mechanism of State Council sent the specific team to get the local team to deal with the situation in an effective fashion. So we will strictly follow a general principle of preventing the imported cases and the local resurgence, and also we will make sure that we curb the spread of the virus immediately, and we also do a better job in terms of transferring cases as well as quarantine the cases in order to curb the further spread of the virus locally. For the places already with the confirmed cases, we will earnestly implement the COVID-19 precaution measures, make sure that there's no continuous spreading of infections. And talking about vaccination, so far, 3.426619 billion doses have been administered, with 1.3 population, 1.2 billion people more already finished their full course of vaccination, accounting for 89.96% of the population, and more than 800 million people have finished their booster shot. 200 million elderly people received their doses, and 269 million elderly people have finished their full vaccination, accounting for 85.63% of the total population of elderly, and around 170 million elderly people also finished their booster shot. And we will continue our press conference regarding the topic of further implement the measures against COVID-19. With us, we have Madame Guo Yanhong from the Bureau of Medical Administration of National Health Commission, Mr. Wang Huajing, Chief Expert of a National Immunization Program, Chief Expert Dong Xiaoping from a National Center for AIDS and STD Control and Prevention, as well as Mr. Han Mengjie from National Institute for Viral Disease Control and Prevention. Now the floor is open for questions. Xinhua News Agency. My question regarding a growing situation in Hainan with reported cases of more than 2,000. What kind of measures have been taken to curb the spread of the virus, and what's your top priority going forward? I invite Madame Guo to answer your question. Thank you for your question. Omicron variant, with its dominant feature, can cause a large infections of cluster cases because the spread of a rapid spread and a strong concealment. So right now, the situation in Hainan is quite complex and is still developing. In order to contain the spread of the virus from the national level, we give more support to Hainan. First, we're giving more a guidance to Hainan in terms of the working phase, and we already sent a team to Hainan to giving on-site support. And also on the 7th of August, we sent 10 teams to the regions with sporadic cases in Hainan province. And for the working group, they also penetrated to the key areas in the community to give the on-site support as well as on-site supervision, make sure all the measures can be implemented. In terms of medical resources, we also give them full support to allocate the anti-epidemic resources. Indeed, the bed capacity per 1,000 people is around 6.02 bed, with 2.91 medical, which is lower than the average level of the nation. So in order to fill in the weak link of medical support in Hainan province, we give more support in terms of medical staff as well as testing people. Therefore, we have sent more than 10,000 medics to Hainan. For testing, we have sent more than 8,000 testing staff, sample collecting staff, as well as the testing facility to Hainan. So Hainan right now can reach 2.4 million tubes of testing per day. And for Sanya, Haikou, and the other 18 regions with confirmed cases can realize this testing capability. Not only for the key regions, we also give more support in terms of testing so they can roll out city-wide testing. Because we know that testing needs fast results, because we have seen the community-level transmission. In order to improve the capability of testing, we support Hainan to conduct one person per tube or one household per tube door-to-door testing in the key region, and for the middle-level risk region as the 5 people per 1 tube testing proportion. So make sure that we can screen out the potential confirmed cases as early as possible. So this is our key experience. We learned from the previous experiences that everything should be done in a very swift manner. And for the epidemiological investigation and the transfer of confirmed cases, this all rely on the testing result. And when it comes to the treatment of patients, right now we have allocated more than 2,000 medical staff, and also we have sent 2 teams to totally take over the corresponding makeshift hospitals to conduct the classified treatment. And also we sent national level experts to conduct on-site treatment, clinical treatment in Hainan. By allocating more helping hands to Hainan, we not only treat confirmed cases, we also want to mitigate the impact to the medical resources for people accessing to their daily necessity of hospital service. And we also send around more than 300 personnel to do the epidemiological investigation work. And third, we talk about that anyone who need, for those in need, are tested, isolated, hospitalized, or treated. And also we can collect and also share the information as soon as possible. And we've tried everything we can to screen out the positive COVID-19 patient as early as possible, and also work closely with other teams to conduct the epidemiological investigation in order to identify the high-risk region, middle-risk region, and low-risk region, and also try to cut off the transmission route. And also, we try to do everything we can to coordinate resources concerning the epidemiological investigation, case transfer, quarantine, and treatment. Make sure that the confirmed cases or the close contacts can have a less touch to the society. And for the confirmed patients, we also make sure that we have a sufficient beds in a makeshift hospital and also the designated hospital, and also to conduct the unified and standardized treatment to the patients. Make sure that anyone who needs to be treated can get their treatment. And in terms of the community level management, first, based on the scientific method, we identify the different risk level regions, and also to implement a different practice in different risk level places to scan out the potential cases in order to realize the dynamic zero at an early date. I believe with everyone's pitching in, we will for sure to curb the spread of the virus at an early date. Thank you. CMG. My question regarding the variants. And we have the BA.5 and its subvariants have been detected in the recent sporadic cases in China. Can we say that these new variants actually impose a new threat to our COVID-19 methods, and also whether that's still the effective regarding our 9th edition of the protocol, and also for this new variant, how we can make sure that we can detect this variant at an early date. Thank you for your question. Right now, all the localities practice their COVID-19 measures follow the next edition of disease prevention and control protocol. We could see that for each round of outbreak that can be cleaned out all the cases at a quite fast manner, and we can see that the next edition so far is still effective, is working against the variant. For the BA.5 Omicron subvariant compared to Omicron other variant, its nature is still the same, but compared to the earlier dominant BA.2, the BA.5 is also with the higher or the faster spread of a highly contagious and stealthy, and very difficult to detect, imposing a greater challenge to our work. And we always mention that early detection holds the key. So we utilized our disease detecting system. So we collect the samples not only from the personnel, but also from the environment, as well as objects. So we talk about that art monitoring system, and we always put a very close eye on the key risk personnel and people working in the hospital, and also the cold chain goods. And also we talk about the key places, like the quarantine places, the hospitals, and we also collect the samples on a regular basis. And also we talk about origin tracing. We try to test the genetic order of the variant. So all in all, what we need to do is we try to follow a general principle of preventing inbound cases and domestic resurgence and carry out the general policy of dynamic zero COVID. Indeed, the Omicron subvariant BA.5 asks us to do an even better job to curb the spread of the virus. People's Daily. The dominant Omicron BA.4, BA.5 for people not vaccinated yet. Can they just wait to the day that they can get a jab of the vaccines against the BA.5 or BA.4? Thank you for your question. Yes, indeed, that for China and also the other countries right now is also undergoing a research and development work on subvariant of vaccination. So we also try to use the vaccine to continue to protect the people, to strengthen their immunity, and also we talk about this new variant, very strong in its feature of highly infectious, highly transmissible, and difficult to detect. So we talk about for the R&D requires time. And also during the current R&D process, also need to deal with a lot of uncertainty. The current vaccine is already proved its safety and efficacy. And so far, the 2 shots of vaccine and the booster shot are necessary for people to build up their immunity level. And still we emphasize that BA.5 Omicron with its rapid spread and strong concealment is more dangerous to the vulnerable group, especially the elderly people. So we emphasize the importance for elderly people to get their 3 shots so we can better protect our elderly people. Thank you. With CMG CCTV. After more than 920 days, Tibet reported newly confirmed cases, which also drew a wide attention among the public. So what the measures we have to better support Tibet to fight against COVID-19? Thank you for your question. Yes, indeed. The outbreak in Tibet also caused everyone's attention, and we immediately gave support and help to Tibet. As you mentioned, before this round of outbreak, Tibet just reported 1 local transmitted case of COVID-19. We could say that Tibet not equipped with rich experience when it comes to COVID-19 prevention and control. Followed a unified arrangement of the nation, we help Tibet to do a thorough work with the great help given by the country. And we also help Tibet to do the pre-planning based on its demographic feature. We help Tibet to build up the makeshift hospitals and also to allocate the anti-pandemic medical resources. For Lhasa, with a population of 870,000 population, and they have around a designated hospital with 200 beds and also a makeshift hospital with 2,000 beds capacity. And for Gaza right now also have a makeshift hospital with 1,000 beds capacity and also a dozen hospital with 1,500 beds. For CPC Central Committee and State Council always touched great importance to support the development of the medical sector in Tibet. From 2015, CPC and State Council helped that the 12 hospitals from Beijing and other places to support the medical capability surveys, skill set, talent cultivating to help Tibet to increase its capability. And also, more than 100 the 3A top-level hospitals also have given assistance to the designated areas in Tibet for the powering support. And also we talk about for the different departments, we also help to do this powering support. So for help the Tibetan hospitals to build up their own department set up. And we not only help a big city in Tibet to build up their capability of a medical build up, we also have the different hospitals to do the pairing assistance to the sub-region and local level hospital service build up. So not only help to deal with the day-to-day hospitalization service access to the local people, but also help them to build up the talent pool as well as the skill set. And we also send the national level experts and from the clinical treatment, testing, laboratory, infectious disease to Tibet to give them more support and guidance. So from this pairing assistance mechanism, different provinces also give support to Tibet. We could see that Tibet is fully prepared to deal with the outbreak. And also with the strength of a national mechanism, this round of the outbreak can be curbed at an early date in Tibet. China News Agency. In the last edition, we could see that the quarantine and also the epidemiological investigation days are shortened to 7 days. Is that enough? In order to make the precaution methods more targeted and effective, the working group carried out the improvement work on the protocol, and we talk about incubation of the Omicron actually is also shortened to 2 to 3 days or less than 1 week. Therefore, based on this new feature, we also shortened the quarantine days. So for the inbound traveler, we also shortened their isolation time. So we try to maximize the COVID-19 prevention and control work with a minimum cost. So right now, the quarantine days as well as the epidemiological investigation days also shortened to 7 days. For the high-risk region, as the lock-off management, and for the middle risk region place that the people, if not necessary, they should not leave their compound. And for the population in the middle risk region with their positive result of antigen test, and for the elderly people with difficulties to get tested outdoor, and we also provide the door-to-door testing service. For the other people that can get tested at the outdoor booths, and we also have the measures and also been proved effective. So for the OD's close-off management, also the date shortened to 7 days. Thank you very much. Now we talk about that the mutual recognition of the testing results across different regions. So my question regarding the current progress of this mutual recognition of testing, because still people, especially when they travel to different regions, they still encounter this kind of the issue. So do we have any solution to this? We talk about that the nationwide recognition of the testing results. Some regions try to find the creative methods to deal with these issues. For example, for some regions, they also have the additional option to upload to the app. And also some regions, they also can switch the database locally and from other place. All these methods are working, and going forward, we're also trying to find a better solution to facilitate people traveling to different places. If mutual recognition is not working, you can contact to the local health commission. And also I call on the media friends also help us to monitor the work. China Daily. In the last edition, it mentioned the inbound travelers need to be tested. So right now, before is that they need to be tested both nasal and throat, but rather in the ninth edition, only throat swab is needed. But also we talk about nasal one is more accurate than throat. So why you cancel the nasal one? So for this change, it's based on our 2-year hands-on experience as well as scientific data. Indeed, some research shows that the nasal swab is more accurate than swab, but based on the large number of data, we not really see a huge difference in testing results of inbound travelers. And also for nasal swab, it also have higher requirements in terms of skills for the testing personnel, and also for the tested people, if they have the injury in their nose, it's not suitable for them to get a nasal swab. So based on all these reasons, we talk about in terms of that the people follow the correct method to get the sample of a throat swabbed, there is really low possibility to miss the possible positive case. Use daily. We have noticed that in Gansu and Guangxi, the cluster infections caused by Omicron occurred in a very short time period. So we'd like to see what kind of experience we have gained so far in terms of fighting against the Omicron subvariant. Thank you for your question. Yes, indeed, as you said, recently the Omicron caused infections reached more than 1,000 cases. In Anhui, so far, the total number of cases is more than 2,000. The number in Gansu, more than 4,500. In Guangxi, Zhuang Autonomous Region, a number more than 3,700. Indeed, this is quite a large number of the cluster infections. But yes, indeed, we clean out all these cases in a quite short time. It's fair to say that first we stick to the overall strategy of preventing inbound cases and domestic resurgence and carry out the general policy of dynamic zero COVID set out by the CPC Central Committee and State Council, and we have done everything follow the scientific method and also make sure that all our COVID-19 prevention and control measures also conducted in a very swift fashion. So first, we have a very flat organization chart, and every time we send the working team from the national level to give on-site support, and also work with the provincial, local level, and village level to build up a working team. So the provincial level help to do the leading job, and for the regional level, are the one to implement all these matters. And second, we always emphasize that fast movement is everything. We talk about this is a race. We need to run ahead of the curve. So we talk about fast is always the key word throughout the whole process of our work. So for the key milestone and work links, we talk about a fast testing, fast transfer, fast investigation, fast transferring confirmed cases, fast quarantine, fast report, and fast treatment. So from testing to the isolation, hospitalization, treatment, all should be done in a swift manner. Third, we should allocate the resources from the provincial level. If necessary, we'll also allocate the material nationwide. So that in terms of testing, epidemiological investigation, case transferring, quarantine, community level management, and treatment. So the resources should be coordinated and allocated to create the synergy. In terms of testing, we talk about testing is one of the key means to find the confirmed cases at an early stage. So we also try to do everything we can to improve the testing capability in order to roll out a citywide or provincial-wide testing. We talk about in Anhui, in Gansu, and in Guangxi Zhuang-Tao's region, we realized that the one round of testing in 24 hours. So we focus on two things. One, quality testing. And second, all people in need should be tested. So for a high-risk region, 1 person per tube. For middle-risk region, 5 people per tube. And for the low-risk level, it's 10 people per tube. So these methods help us to screen out the potential various carrier. And we talk about the epidemiological investigation, and we send more helping hands to do the work. So for the investigation personnel, and we also send more helping hands from other province or regions. And for the key regions or for a targeted group, we also to make sure that no one left behind if needed in order to screen out a potential risk at the community level. And when it comes to community, we also emphasize the roles and responsibility as well as the working mechanism at the community level to fight against the COVID-19, especially the close-off management and the high-risk and mid-risk region. So we can build up the system across the board to conduct all-round comprehensive prevention and control work. So from practice, we have proof that the next edition is working and effective. Oriental TV. A question regarding vaccination. How vaccines play its role? And would you please share some data to us? Thank you for your question. We know vaccine first can curb the spread of the virus and also help to lower the possibility of severe cases or deaths. So based on our monitoring and the data collection, we see that the fewer number of serious cases and death cases. World Health Organization mentioned two things. First, with a large population vaccinated, we could see that these help hugely reduce the number of severe cases and death toll. And the vaccination also can help to mitigate the overwhelming hospital resources. So talking about the numbers, it's 19.8 million. This is a number given by the World Health Organization. And also there's an article released at the journal, a Lancet. So it's from December 8th of 2020 to the December 8th, 2021. And the vaccination helped to reduce 19.8 million people from dying caused by COVID-19 variant. We talk about vaccination have hugely changed the development path of the pandemic and saving tens of millions of people's lives. CMG. Monkeypox also identified as the emergent public health risk. So what's the risk level of monkeypox in China and how we can effectively protect ourselves from getting monkeypox? Monkeypox is caused by a monkeypox variant. It can be found both on human beings and animals. So we could see that the symptoms showing with the phyton lymphoden. So far we have seen that more than 70 countries reported the confirmed cases caused by monkeypox. Right now in China, we have not found the monkeypox cases. So its transmission route, first it's transmitted from animal to human being, so through a blood. Where human to human transmission is from a long time close contact. It also can be transmitted through droplets, but it's different from COVID-19. That droplet should be a long time contact. And it also can be transmitted from mother to baby through placenta. Monkeypox is a self-limited disease and shows in the younger age or people with quite weakened immunity level. So right now it has two subvariants. One is the South African variant. Another is the variant from a Middle Africa. We talk about right now is a public health emergency. And this June, we have already released the 2020 edition of monkeypox prevention and control protocol, as well as the technical guidance to give the guidance to the localities to deal with monkeypox. And we will also do the following. First, and we'll put a very close eye on the development situation of monkeypox worldwide. And also we will conduct the scientific-based evaluation of the monkeypox situation. And second, we will also to test monkeypox, especially the travelers from the monkeypox confirmed place. And third, we're also to train the medics, because majority of the medics not have the experience in dealing with monkeypox. So people can be trained to treat and test monkeypox. At the same time, we also prepare ourselves with the medical resources so we can better protect people's life and health. Cover news. A question regarding whether there's any severe cases caused by Omicron subvariant and what kind of the features. For the elderly people or people with underlying disease or people unvaccinated, if they infected with COVID-19, it's easy for them to develop to severe situation, so imposing a challenge to the treatment. And in Hainan, we have seen severe cases, and in Guangxi Autonomous region, we also saw the situation, and also in Gansu, we have seen 27 cases develop to severe situation. And because that's so far this round of cases, especially that the cases happened to these mountainous area that they have a chronic infectious disease. And in Gansu, 27 severe cases already developed to a normal cases or already discharged from a hospital. Right now, only 3 is hospitalized. So, but still, it's ring the bell to us that we cannot say that because it's not that easily to develop to the severe cases. So we can relax our guard against COVID-19, especially the transmission among the community level. There's still possibility of the cases develop to severe or serious situation. For each serious situation patients, we always follow our 4 practice. Make sure that we allocate the resource of medical staff and medical resources to treat the confirmed patients. And we also signed the experts with rich experience from ICU, from infectious disease, from traditional Chinese medicine, to work with local experts to conduct the ward investigation. And also the consultation. And also we organize a group consultation on the virtual platform to provide the customized treatment plan to each and every patient. For hospitals and with sufficient resources, the eligible staff are identified as the designated hospital, so the confirmed cases will be treated in all these hospitals. And we talk about that cases with a mild or a normal symptom, and they treat it in a makeshift hospital, but still we also send the nation-level expert to give the treatment to those patients. And we also make sure that we put a close eye on DA patients, make sure that we found DA patients with worsening symptoms at an early date, so we can transfer them to the designated hospital immediately. Following the next edition of the protocol, we also give the standardized treatment. We give it enough nutrient and so give the inspiratory support as well as the psychological support to make sure that we are taking care about their physical health but also mental health. And also at the same time, we also coordinate the strands of Western and traditional Chinese medicine. No matter at the designated hospital or a makeshift hospital, we always emphasize to leverage the role of the Western medicine and the traditional Chinese medicine. So far, a principle and plan to treat a patient with serious situation is working and the results is satisfied. Phoenix TV. We have noticed this round of outbreaks happened to some remote places, so that also showed the weak capability in terms of testing and the investigation, epidemiological investigation, how we can help them to do a better job. Thank you for your question. Indeed, in this round of outbreak, especially in Gansu, has found the sporadic cases in less developed region. For these places, as in a high altitude and also mountainous area and the people living in the quite far distance, we cut off the spread of the virus and also clean out the cases in a very shortened time period. And we have done the following. First, we dispatched the specific working team to conduct an epidemiological investigation. We have a flat leadership. The provincial and the local leadership are there to allocate the resources, and also from the national level and also the provincial level, the additional investigation personnel are also dispatched to the remote places. So the public security, industrial and information technology, and public health departments work in a synergy manner. And we also build up the information platform. And in 2 key regions, we established 24 working teams to realize the sample transferring in 2 hours and outcome available in 6 hours. So based on the weak links of the local epidemiological investigation work, so we worked following the existing system while improving the weak links. So the working efficiency and working mechanism have been improved. So that also helps us to identify the confirmed cases, the high-risk people, and also the high-risk regions. So the epidemiological investigation report can be finished within 24 hours. For the quarantine places, for the places with high risk of a cross-infection, and also the remote villages, also conducted a thorough investigation work. Going forward, also help to build up their know-how at the local level. So first, a flat command team and the working system is needed. So information can be collected, shared in a faster manner. Second, monitoring and alarming system is needed, especially on a regular practice manner. The clinic, a fever clinic, a pharmacy should be the whistleblower. Help us to identify the infections. And third, is we need to train the team to improve the medics and testing people's capability, and also the community level working staff. Thank you. Economic Daily. Some people believe that for the elderly people, they not really go out frequently. It's not necessary for them to get vaccination. What's your take on that? Thank you for your question. We have answered this kind of question previously. I would like to emphasize that we talk about the elderly people that did not conduct outdoor activity. Doesn't mean that there's zero possibility to get infected. We talk about they still have the contact with their family member, or the elderly people still contact with the people working at the nursing home. So still, we talk about the Omicron variant. It shows the high infection, high transmission, and also hard to detect. So that is why we always encourage the elderly people to get vaccinated. So far, the vaccination rate is much improved, especially for some places. Vaccination rate over 90%. But still, we have seen some regions the vaccination rate less than 70%. If that place, the outbreak happened, then the elderly people, especially people above 80 years old, have a high population to get infected or develop to a severe situation. We talk about vaccination is the best weapon against the vaccine, and also help reduce the possibility of a severe situation and death. And it's also a easy and feasible way to get people protected. We talk about the vaccination is a very specific COVID-targeted method. So if people not vaccinated and the elderly people, looking at the proportion of them getting a severe situation or getting into the ICU, it's very high. So we talk about the elderly people. Still, it's very necessary to get vaccinated, because still need to take some time from vaccination to building up that protection net in their body. Two last questions, please. Thank you very much. Red Star News. According to the media coverage, the region's waste outbreak, so right now constructing the makeshift hospital. Right now, a cluster of infections caused by dominant Omicron subvariant. What kind of role has a makeshift hospital played? The feature of Omicron subvariant is very clear. It's rapid spread and strong concealment. So it's very easy to cause a large number of infections or a cluster cases. So in a very short time, we need to make sure we have enough bed to hospitalize and treat patients. This is very conducive to curb spread of virus and treat the patient. And we talk about we not only hospitalize the COVID-19 patients, but we also need to have enough bed to hospital patients with other disease. So makeshift hospital is a very important way to provide sufficient beds. In the next edition of protocol, it stipulates very clearly that COVID-19 patients should be hospitalized in a classified way. For the confirmed cases should be treated in the designated hospital, and for the patients with asymptomatic symptom or mild symptom can be treated in makeshift hospitals. So we talk about that we need to make sure that we can treat the patients with COVID-19, but at the same time, we also have enough sufficient beds and medical resources to treat patients with other diseases. We ask localities they can utilize the exhibition hall or a sports stadium to do a pre-planning, so they can build up like a water supply, like the utility supply, electricity, a washroom, and ventilation. This work can be done at early dates, as well as that a broadband also can be installed at these large space facilities. And we also talk about for the medical resources for a makeshift hospital also should be storage. Third, also have enough medics personnel, and all these personnel should be well trained, so we can have this backup team. So all these make sure that once the outbreak happens, the makeshift hospital can be initiated right away and be the home to treat COVID-19 patients. From our actual practice, the usage of a makeshift hospital help us to reduce the impact to the medical resources for other diseases, and also provide the sufficient support for the COVID-19 patients to be treated. '21st Century Herald, we have seen the influenza is also seeing a curve going up, and this could bring a combined risk caused by influenza and COVID-19. And autumn is coming, so what we need to pay attention in the fall season to deal with these two diseases or variants. So for influenza in China from 2000 to 2020, 2020 to 2021, the influenza actually ran at a very low infectious level. And one reason is that China practiced very strict precaution methods against the COVID-19. So because of all these, the practice and also the influenza vaccines that all help to lower the influenza infection number. In the summertime this year, in the southern part of China, we have seen the quite a peak wave of infections caused by the influenza, and it's a high possibility, judged by the experts, and we could see a high-level influenza epidemic in the fall winter time this year. We talk about either fall winter or winter spring period. We could encounter a combined risk caused by COVID-19 and influenza. Therefore, we have also a combined countermeasures. So first, we put a very close eye on monitoring influenza. Our monitoring system is leading the world. We talk about the whistleblowing fever clinic and also laboratory playing their roles. And for the fever clinic, and will also to do the triage in order to identify either they are with influenza or they are with COVID-19 virus. Once the influenza-caused epidemic outbreak happens, or the outbreak caused by COVID-19 happened, we also strictly follow the prevention and control measures. Fourth, we will also promote the administration of influenza vaccine and also suggest localities to do their preparation work. And the fall and winter season is coming, and we also ask the public to protect themselves from the respiratory disease. And for the elderly people and also the medic staff, they should be vaccinated if necessary. And if they have shown any symptoms, they need to visit a hospital as soon as possible. And also for us, we need to practice the normal practice like conducting ventilation, washing your hands, and wearing masks. Thank you. In today's press conference, the speakers introduced the current situation against COVID-19 and other epidemics. Please always follow us to get the updated information. Thank you all.